The COVID-19 crisis has been a human tragedy, impacting the life of every person on the planet. And at the same time, the pandemic has revealed major inequalities around the world, particularly when it comes to hygiene. It's why the Global Hygiene and Behaviour Change Coalition, HBCC, was established. The HBCC is a unique partnership between Unilever, with their expertise in hygiene education, behaviour change and mass media communication, and the UK government's Foreign, Commonwealth and Development Office, the FCDO, who are well placed to rapidly deploy a global programme in the fight against COVID-19.
Unilever was founded with a vision to make cleanliness commonplace, and today we continue that mission during this COVID-19 pandemic. We've been working with partners like UNICEF, the UN Refugee Agency and the UK government to make good hygiene accessible to everyone, everywhere.
Hygiene is a pivotal part of the UK government's approach to tackling COVID-19. Around the world, our network of embassies and high commissions and our great existing partnerships meant we were in a unique position to respond quickly. And this incredible network is supporting 37 of the world's most vulnerable countries to promote hand washing and good hygiene.
And that has been the HBCC's driving ambition, to provide care and support to limit the spread of COVID-19 in vulnerable communities around the world. This £100 million initiative has allocated funds to 21 NGO and UN organizations to run programs in 3 key areas. Improving infrastructure through the installation of hand-washing facilities and by providing hygiene products like soap, sanitizer, and bleach. Through hygiene behavior change, awareness and education, improving hygiene across schools, healthcare facilities, and communities. And through support for vulnerable groups such as health workers, refugees, and migrant workers. The coalition also works closely with leading academics, such as the London School of Hygiene and Tropical Medicine, who have provided scientific advice to support HBCC projects.
20 countries across 6 regions, UNICEF supported government-led coordination of COVID-19 responses, delivering hand-washing and hygiene behavior change interventions. We also worked to ensure that people were not cut off from their access to safe drinking water, sanitation, and hygiene services in the midst of the pandemic.
Thanks to HBCC, CARE is providing life-saving support to women and girls who are on the front lines of fighting the pandemic, but who are also most vulnerable to the virus because of their roles at home and at work.
تعلمنا يعني التباعد الجسدي وكيفية غسل الإيدين بطريقة صحية يعني مدة 20 ل 40 ثانية بالكحول وبعدين 60 ل 40 دقيقة بالصابون وارتداء الكمامة بطريقة صحيحة.
Thanks to this award-winning private-public coalition, the scale of our impact has been huge. 37 countries with HBCC programs, over 1.2 billion people reached with hygiene awareness and education materials. Over 78 million Unilever hygiene products donated, including over 65 million bars of soap. Over 260,000 key workers trained, and hundreds of thousands of hand-washing facilities installed around the world. It is important, now more than ever, that we do not forget the critical importance of hygiene access and education in preventing infectious disease. As we build back from this pandemic, we urge all key decision makers to prioritize communities' access to safe water, hygiene, and sanitation. Today, we can make sure that no one is left behind and that everyone, everywhere, has access to these essential, life-changing resources.